Mahatma Gandhi once said, "A man is but a product of his thoughts, what he thinks, he becomes." Good day, everyone. We are the Group 3A from BSN 3C. I am Fryll Montaño, and together with me is my fellow researchers Maria Alyssa Brianna Jochico, Maria Lourdes Joy Marcojos, Maureen Joy Miranda, and Jaira Murillo. We are here to present our research entitled Self-Efficacy of Nursing Students and Blended Learning. The COVID-19 pandemic has made nursing students' already heavy workloads even more challenging, according to Fitzgerald 2021, due to the unexpected conditions brought on by the COVID-19 pandemic, such as worry and anxiety. Healthcare students' self-efficacy has diminished. According to Alimani Ariboa et al. 2020, academic self-efficacy affects overall academic achievement and outcomes, and is a critical predictor of student success in science. Thus, the study aimed to determine the self-efficacy of nursing students and blended learning.
The study utilized a quantitative correlational approach. By definition, the procedure of gathering and interpreting numerical data is known as quantitative research. The survey method, standardized and modified standardized questionnaires, were used for data collection. Surveys are a common way to collect data in order to learn more about a group's traits, interests, viewpoints, or beliefs.
There were 275 level 3 nursing students in the population. The sample size was determined by using Sloven's formula, and as a result, the sample size for the study was trimmed down to 169. Although only 154 participants were able to respond in the study since some of them refused to participate.
Instruments. The study utilized a two-part questionnaire. Part 1 was the Online Learning Self-Efficacy Scale, a standardized questionnaire for measuring the self-efficacy of students in online learning, and Part 2 was the Self-Efficacy of Learning, a modified standardized questionnaire for measuring self-efficacy in face-to-face setting. Validity of instruments was 4.1, which interprets as highly valid, and reliability was 0.94, which interprets as excellent.
In the demographic profile of the participants, the total number of Level 3 nursing students that participated in this study was 154. It exhibits the distribution and frequency of the participants' demographic profile when classified according to sex, section, connectivity status, and area of residence. The results imply that the profession of nursing is considered a female-dominated field. Moreover, in web surveys, when compared to males, females were more likely to respond. Students who live in rural regions or have poor internet connectivity may find it harder to keep up academically. The educational losses may have a massive effect on career opportunities and academic progress. In comparison to students growing up in rural areas, students in urban areas consistently develop higher levels of human capital subject to observed cognitive ability and different family characteristics. In addition, the difficulties and dangers of living away from home, as well as the necessary cost of setting up and maintaining a new settlement in the city where they will be studying, are disadvantages for rural students and their families. In the level of self-efficacy of nursing students in online learning, the highest among the variables is the technology use, next is learning in the environment, and lastly is the time management. All variables have a verbal interpretation of time, in which it implies that participants performed well during online learning. Although results show that time management has a higher standard deviation than the other variables, which implies that the data is more spread out. This may be caused by the participants answering a rating of 1 to 3, which is considered low, but the majority has still answered a rating of 4 or 5, thus the mean being interpreted as high. In the level of self-efficacy of nursing students in face-to-face learning, the corresponding mean, standard deviation, and verbal interpretation of self-efficacy of learning scale using the Bloom's taxonomy that are categorized namely knowledge, comprehension, application, analysis, synthesis, evaluation, and as a whole. Data reveals that the highest mean in the survey is synthesis, which has a corresponding interpretation of high, which implies that participants in the study generally thought highly of this variable. As shown in the results, the analysis and application has a wide standard deviation in which most of the participants answered in the 1 to 3 range, indicating a lack of time management during the face-to-face classes. In the difference between the level of self-efficacy of nursing students in online learning and face-to-face learning, the significance of the difference between the online learning and self-efficacy and learning was tested using the Mann-Whitney. The results showed that all sets has a greater mean than the self, which implied that their self-efficacy in online learning was higher than face-to-face learning. Relationship between the overall level of self-efficacy of nursing students and profile variables. Given the values as seen on the table, the results indicate that there is no significant relationship between the overall self-efficacy of nursing students and profile variables. Hence, this implied that the profile variables, sex, section, connectivity status, and area of residence are not indicators of the self-efficacy of students. Therefore, it is recommended to expand and explore more profile variables that could potentially influence the self-efficacy of nursing students to uncover relationships that were initially not apparent.
In conclusion, with a total of 154 participants, female nursing students outnumbered male nursing students. The majority of the participants belonged to sections under Cluster 1, had stable connectivity status, and lived within Bacolod City. The results on the participants' self-efficacy during online learning and face-to-face learning were all high, which implied their self-efficacy during both learning modalities were high. However, ALSES revealed higher self-efficacy among nursing students. Profile variables were not indicators of the self-efficacy of nursing students, and the results showed no significant relationship between the former and the latter. University administrators and nurse educators may identify what aspects of blended learning should still be enhanced. Nursing students and their parents can discover more of their preferred study routines in this blended learning setup while considering the variables that will help with their self-efficacy. Further, researchers may broaden this study by conducting surveys with other participants and incorporating their implications, thereby sustaining new information and decisions appropriate for the enhancement of the student's self-efficacy in blended learning. Finally, this study could be a reference to schools administration to consider utilizing this blended setup as a mode of learning. Nursing faculty could implement this setup when factors that delay academic plans arise, thereby allowing students to keep up with their academic activities. Thank you so much for your interest and attention. Have a good day and God bless.